Welcome to the Microdosing for Healing podcast. I'm your host, Casey Garrett, and together we'll be discovering and learning from inspiring voices of healers, medicine keepers, and visionaries. Every episode, we'll explore the world of health, vibrant wellness, and natural medicine for a new era of human society. Welcome to today's episode. Hello, everyone. Thank you so much for being here today. I'm really excited to bring you another trio episode. So many of you have written and said you're absolutely loving our kind of roundtable style podcast episodes. So I'm really excited to bring you more of them. And today is going to be an extra treat. If I seem very familiar with these beautiful women, that's because I am. They are three of my most favorite colleagues in the space. I work with all of them. Some of them appear in the course. Some of them are close collaborators with our microdosing community will recognize some of them instantly. And I'm really excited to have a conversation with them that is really real, really authentic, and really speaks to what's up for a lot of you and up for a lot of your very present questions that you may not hear answers to otherwise. So I wanted to start off today. I'm going to share their bios, which are all beautiful with you. And then we're going to have a really free-flowing conversation from there. So first to introduce Dr. Julia Mirer. She is a pioneering voice in the realm of psychedelic medicine, leveraging her background as a former physician to champion education and advocacy in this transformative field. Notably, she actively participated as one of the overseen physicians in a groundbreaking study employing psilocybin for treating major depression, a pivotal moment in advancing understanding and acceptance of psychedelic-assisted therapies. Currently serving as the Director of Strategy and Impact at newcomers, a distinguished ketamine clinic based in New York, Dr. Mirer stands at the forefront of innovative healthcare delivery. Her multifaceted expertise extends beyond traditional medicine. As an ardent speaker, educator, strategy consultant, and coach, Dr. Mirer epitomizes dedication to reshaping healthcare paradigms, bridging knowledge gaps, and spearheading a transformative movement toward comprehensive and integrative wellness practices. Woohoo! Yes. Jennifer Zuckerman. Jennifer Zuckerman is a compassionate, thoughtful, open, and straightforward practitioner. She is passionate about holistic health, wellness, and helping others advocate for and maintain their own health. Approaching healthcare from a functional perspective, Jennifer seeks to uncover and address the root cause of imbalance rather than managing symptoms. After many years working in a traditional Western medical practice setting, Jennifer consistently felt frustrated with the lack of time available to spend with patients, the high volume of patients being seen in one day, and the overuse of pharmaceuticals. As the current Western model is designed, she felt unable to get to the root of whatever a patient was physically presenting her with at the time. Educating and exploring the role of psychedelics in treating mental, physical, emotional, and spiritual health, Jennifer began to move away from a traditional Western medical model and decided to be an agent of change in creating the new psychedelic medical model. Creating a conscious clinical practice, Jennifer has been fully focused on and within the psychedelic space for the past 5 years. Beautiful. And Dr. Emily Kulpa. Emily is based in Portland, Oregon, and is a pharmacist, consultant, educator, and licensed psilocybin facilitator. Specializing in harm reduction education, antidepressant tapering support, and psilocybin facilitation, she brings a comprehensive approach to mental health care. As a certified trauma-informed professional with NARM training, she applies a deeply empathetic and nuanced approach to her work. As a highly sensitive individual with complex PTSD, Emily has personally faced depression, anxiety, and suicidal ideation. She found traditional psychotropic medications ineffective and discontinued their use 7 years ago. This personal challenge fueled her commitment to a healing journey, guiding her towards wholeness and self-integration. Emily is currently accepting new clients who are seeking legal psilocybin services in Oregon and those looking to join her upcoming program for support in tapering off antidepressants. Please welcome these dynamic, brilliant women. Thank you so much, all of you, for being here. So I wanted to start off with Julia today. So great first question for all of you. Jill, the mainstream marketing of psychedelics makes great promises and consumer appeal. but are psychedelics for everyone? And if someone is brand new to psychedelics, what are the most important factors and considerations in your opinion? What do you feel are important factors people should educate themselves about first?
Beautiful question. And thank you for having all of us here. So mainstream media was very valuable in helping to fuel the attention of the attention that was brought to the psychedelic industry. And so that was very valuable. And in that initial phase, yes, telling people that it works and it's great, very useful. You started getting big, investors more interested. You got universities more interested. You had big names like Johns Hopkins pushing forth research in psychedelics. The problem became pretty apparent during the psilocybin trial that I got to be a part of because with the exception of our first client or our first volunteer, it was a placebo-controlled study. So retaining people when they didn't get their miracles was one problem. The second problem was when people had an experience and it wasn't this life-changing moment, and it was really frustrating for them. And so that expectation management is what we had to deal with because of the mainstream media. And for anybody that's coming to this, the example I like to give is when someone comes in after decades of treatment, they've tried holistic approaches, they've tried therapy, they've tried different medications, they've gained some tools over the years, but they have a very messy toolbox. Every time a tool doesn't work, they just throw it in there and they're like, get this. And then when they come to a psychedelic experience, the way that I like to think of it is when they come out of it, they have this very organized toolbox and you know exactly which tool to go for, depending on which project is in front of them. And so I think any psychedelic experience, this is important for people to know, 80% of the benefit is the preparation with education beforehand, and then the integration with community or like-minded people afterwards. And the reality is that if you're not coming in with much, you're not going to come out with as much. It's like Michael Pollan, I think, said that psychedelics are wasted on the youth because you're just still trying to figure out that initial perspective. You don't need a new perspective. So I think for people managing that expectation, understanding that this is not something that will necessarily be the end all be all, but it will be that opportunity to feel a sense of hope that you can do those things to move forward. If you do feel relief from a big psychedelic experience, and a lot of people do. So that's a little caveat. Mainstream media is very correct about a lot of things. It's just not for everyone. And so knowing that this is just a step in the right direction, this is just that thing that reminds you that life is worth living. It's that thing that reminds you, wait a second, if I really pay attention, I have so many great things in my life. Maybe I do want to start exercising more to stick around longer. So I think from my perspective is that it's not looking at this as a magic bullet, which is how it's sometimes presented, but as the first step on a very fulfilling journey.
Beautiful. Well said. Jen, next question for you. There's so much misinformation and inexperienced opinions floating around about psychedelics, particularly around psychedelic use for people who are currently on prescription medications. So what are some of the important things to know if someone is listening who is on prescription drugs? What are the important things for them to consider and know?
Sure. There's a lot of yes and that I believe through the answer in this question, because there are different psychedelic molecules that one can work with. And that's also where that the preparation piece is so valuable, and to have a clear understanding and understanding of where this person is, what their physical vessel is experiencing, then looking at the mental and emotional. You will prepare somebody differently that's going to meet ibogaine than you would to have a ketamine experience, for example, because ketamine has less drug-drug interactions that we aren't as concerned about. And it's also a beautiful stepping stone. I call it stepping stone or bridge for those that are desiring to get clearer with their physical vessel and letting go of some of these medications. And it shows up and it's very safe. So they can still remain on their SSRIs or antidepressants, anti-anxiety medications, sometimes mood stabilizers, depending. I always say it's yes and. If you come to me as a potential provider or client, I can assess where you are and your readiness. If you have certain medications on board, then I'm not worried about interacting. That said, if you're just newly getting put on a new regimen and you're imbalanced in that capacity, let's focus on what we can do to get you more stable so that you can then enter into these spaces. So like Ibogaine, for example, there's a lot of substance use disorder that goes to meet that molecule. Well, if they're being treated with Suboxone, they need a specific amount of time, at least 6 weeks, I like 8, before they go in, and to create a program and protocol for them as they start to safely taper off medications, have their experience. This is where integration comes in, and the other tools that they're learning in this process. We have a collaborative care team with them so that we know, okay, let's see how they do off of certain medications in this time. And maybe we do bring back certain things, maybe one at a time, if necessary. Sometimes it's not. It's like giving yourself a new clean slate. And with psilocybin, for example, we worry, and with ayahuasca, but I think a lot of people have some fear around serotonin syndrome, which is fair if someone is on a multitude of different SSRIs at certain doses and other cocktails of medication. And we're also then giving the opportunity to the molecule to really get in there and start doing its work with that person. So I think we can educate more with what we can and cannot do as far as medication management, medication tapering, and preparing the individual for their meeting of these different molecules, because each one is different and so is the individual.
Perfect. Thank you so much. Emily, next question. So as a pharmacist, you consult frequently with clients who are tapering off prescription drugs while microdosing or preparing for a high dose ceremony. For listeners who are contemplating tapering off their medications, what are some of the most important factors to consider around tapering specifically?
Yeah, thanks for that question, Casey, and it's great to be here. I think for people who are considering tapering off psychotropic medications like antidepressants and anti-anxiety medications, I think there is a couple of things to consider. One, I do think it's important to keep your prescriber in the loop, right? Or try to find one that is supportive of tapering off, because you are going to need someone who is going to be managing that meds. And as you get down, if you're going to taper off, there might be doses that they're going to have to prescribe that aren't available on the market. So you're going to need somebody to do the medication management piece. I think another important component is being intentional about it. Setting an intention. Why do you want to get off of the medication? Is it just to have a psychedelic experience? Is it because there are other side effects? Have you just been on it so long that you don't know if it's working, or not? So I think having that intention is important. And that way, too, you can come back to that, because it can be challenging to taper off of medications. Another important piece is, assessing readiness. And if you need to taper off, I think like Jen was kind of speaking to, there might be other modalities that might be a better fit for you, depending on where you're at and the types of medications that you're on. So you may not need to have to taper off. So I think talking to someone who can provide you with, some of that education so you can make an informed decision is important. And like assessing for readiness too, really taking time to reflect, where are you at? Are you stable? What do your depression and anxiety symptoms look like? Are they manageable right now? Or are you in a crisis? Maybe if your intention is to taper off, maybe right now is not the good time, but maybe in the future that, you might be able to start the taper process, and making sure that you have enough support around you and you have other tools and modalities that you can use during this time to set you up for success. I think another thing to consider is expectations around it. I think a lot of people that I see, they really want to taper off really quickly, right? Or like they want to, they're like, oh, I found a guide. Like, I want to do this journey. Like, can you get me off, in like 2 months? So I would say it's probably going to take you longer than you thought or that you would like. I think based on, there isn't a lot of research that has been done on tapering off of medications, but on the stuff that has been coming out over the last couple of years, what we've seen is that like the slower you do it and the lower kind of stepwise, and, there's different types of strategies that you can use that's going to set you up for success. And, we know that withdrawal symptoms are a thing. People can experience flu-like symptoms, dizziness, nausea, increase in anxiety, the brain zaps. Those are all things that could happen. And so I think if you, are intentional, assess for readiness, and give yourself some time and have some patience with it, you may not have to suffer through those as much as if you're trying to like rush this taper process. So I think, just setting expectations is an important thing. And I think just getting in touch with somebody who has the right knowledge. So even if you're working with a facilitator, they may not have that healthcare background and be able to support you or guide you or even educate you on what are the risks, what are the benefits, are you an appropriate candidate? Maybe you want to do this modality. Maybe it's not a good fit right now. Maybe there's another thing that we could use. Maybe you could do that down the line. And someone you can kind of just help them piece it all together and where and when they can fit in the tapering process. I would say.
Thank you so much.
Chime in to something as well. There's one thing that I notice with people in tapering. Let's say that clinically they can drop from 150 to 75. Mm-hmm. But if they only believe that they can drop to 100 without something bad happening, then you go to 100. Because pushing someone past that, clinically they're fine, but you're not actually addressing the person. And if we look at psychedelics, how many people are coming to this because they've been on medications for so long? Like, I think 8 out of 10 times you'll find a person telling you, the last time that I went off my meds, XYZ happened. Well, great. Now that's been planted in your mind. So now there's this fear and this expectation that the next time you stop, even if you do it differently, something bad is going to happen.
Yeah, I agree.
100%. Yes.
I'd also like to chime in. Yes. So as you know, I've tapered almost 500 people off of their medication successfully. So this is my passion project as far as a provider. And what I've also noticed is sometimes people are meeting you at some other Western trained professionals will just throw pasta at the wall to see if it sticks with these individuals, because this individual is struggling and they're grasping for straws as they're trying to like get out of the hole that they may feel that they're in. And so their systems are just regulated from the multitude of meds. They're switching really quickly, sometimes not, but I've seen that there are some that are. And that's also where it's up to the professional to make a decision as far as stability for them. It may be best for them to taper off and have a fresh start, and then giving them that mental reassurance, and also engaging in where are these thought patterns coming from, because there is an emotional piece to our physical manifestations of what's happening in our body, and getting into that root of what's going on in there. The other part is on the working with other facilitators in the space. As a professional, I also want to know that this facilitator is equipped to meet this person where they're at. There are some that are great working with clients that don't have a multitude of mental health issues. That said, if we're worried about the scales moving too quickly, I would like to know that the person that's going to be serving them these molecules is equipped to know what to look for, or then ask somebody like myself or Emily, hey, this is going on. What do you think? That said, another part of this is we don't play telephone. Like if you come to me with a question as a guide or a facilitator and it's not my client or patient that I'm seeing, I get to have a meeting with them, because what looks like this for them is different, and their medication management that can help those symptoms so that we can serve them plays a role. And so I just encourage those to really value that we all are doing this as a team and we're collaborating and supporting each other in the process.
Beautifully said.
I just want to chime in, Jen, because, and that is why I have intake forms and I don't do that. Does this interact with this and that? Because in the way that you're trained as a pharmacist, it's like there might be questions that you're not necessarily aware to ask that like all of these things kind of interact and can affect each other. And so, like Jen said, it's really important to, get a whole comprehensive picture, because they might just not be thinking, in the way that you're thinking of things that could be really important for the client.
And verbalizing with them in front of you, because sometimes people forget their medications, their doses. Oh, yeah, I did have this. Oh, yeah, I did have this show up on my EKG last year. I didn't think about it. So if you get them in front of you, then you get to really get into the energy with them, and they can remember things that they might not if they're filling out a form and you're not looking at them.
Beautiful. Thank you all so much. Julia, shifting into a topic you are mega passionate about, I know, youth mental health and the widespread use of prescription drugs for children and teens that we have seen in the last few decades. So can you share a little bit more about this subject and the consequences of medicating our youngest generations and how we might approach supporting our children differently going forward?
I jotted some notes down from a book just to make sure that I'm quoting this correctly. And the book is called Children of the Cure. And it highlights study 329, which is with Paxil, paroxetine. And it basically talks about the study that came out, and it was looking at Paxil for mental health in adolescent population, in pediatric population. Now, the study was actually cited for years, for decades, as this really great example of how this works in kids. Now, unfortunately, when they did a review of the study, which took a very long time, so there's now two versions of the study out at the same time. One is the original. The second one shows that there was an increase in relapses in the Paxil group. They looked at all the same data. There was no difference in efficacy between placebo and Paxil, and there was a dangerous tapering phase. So when you were tapering off of the medication, as Emily just brought up, there were major side effects. There were major adverse events. Now, throughout the book, it talks about, emotional lability. That's what they were calling suicidal actions. And the reality was that the risk of suicidal events and serious self-harm was double for the youth. They knew this in 1989. The black box warning didn't come out until 2004. Guess what? After 2004, they started a rebranding. All of a sudden, juvenile bipolar disorder started to increase in numbers. Because if you had suicidal thoughts after taking this antidepressant, you actually must be bipolar. So this is awful for our adults, but we're doing this to children. There was an article that came out in the New York Times a couple of years ago about this teenager who, when leaving school, she was already on 9 medications. This is not abnormal. And the problem is that, aside from the fact that the studies are built in a way that make the study drug look better, the doctors don't know any better, so they're practicing standard of care. The doctors that do know better can't do anything because it's their license on the line if they go outside the norm, which is these are the symptoms, this is the medication. And the SSRIs have never been shown to be effective in this age population for any study. There was 30 randomized controlled studies, none of them showed efficacy. And this is still our standard of care. Our standard of care includes symptoms for the patients, genital numbing. It can inhibit growth, increase weight, which creates a plethora of mental health issues. And it can even cause miscarriage. And we don't talk about this, but the dependence. You become dependent on this drug. And what's worse is that these young developing minds become identified with their diagnosis. So this age population, our parents didn't get us, our parents' parents didn't get us. We didn't have access to TikTok to self-diagnose and identify as someone who is borderline or identify as an anxious person. So the process of discovering who they are is actually compromised. And so you have that combined with all the downstream effects of being on medication for a long time. And I know that I referenced Poland's, psychedelics are wasted on the youth, but I'm actually actively moving forward in my career to say the opposite. And the reason for that, I'm not saying that, oh, kids should be out there doing really high doses. No, I'm talking about microdosing with supportive therapy. And that's like, I'm not saying that it won't be beneficial for them later on, but I'm saying that this tool is probably going to follow more of the Charlotte's Web model, the cannabis oil for seizures, for pediatric seizures. This was not scientific research that led to this being applied. It was parents who took a risk and then screamed it at the top of their lungs that this worked, and then science paid attention. And so I think for this population, these adolescents, these late teens to early 20s, they're suffering so much right now. And people, like their parents, think that their kids are broken, but no, it's the system that is being used to try to address their issues is broken. And so one thing that I'll read off here, this was a different article, and it was talking about a doctor that came, he was actually, or she, from the Dagara people. And this is an indigenous group that for them, they view mental disorders very differently. So in the shamanic view, mental illness signals the birth of a healer. And so I love reading different books because from the scientific books to the kind of self-help to the spiritual ones, it all says that this crisis is actually something that is to be paid attention to, not to be dulled, not to move the symptoms away. And one thing from this article that really stuck out was the idea that this mental health break, this is a message from the other world, that something's not in alignment. And so it's actually like the spirit realm is trying to tap on a person and say, wake up, wake up. It's a message from the spirit realm to the community. And it says that there will be a tendency from the other world to keep trying as many people as possible in an attempt to get someone's attention. They have to try harder. And like, I know I have my medical degree, but I did a full pendulum swing to the woo-woo side, and I found my spot in the middle. And in the middle, this still sounds really true. And if we look at the worsening mental health conditions and we think about the people who are affected by this, we're sitting here. We had our mental health crisis. We chose a different path, and now we're here trying to fix the system that is broken. So to me, these young adults, like they're the future ones that are going to be doing this. So if we're robbing them of their gifts, if we're giving them diagnosis that prevents them from doing what they're here to do, we're compromising everybody. And so, yeah, there will be a lot of things that I'm coming out with this year talking about this, whether it's with ketamine or other psychedelics to come. Like, I think parents will be a huge driving force for this moving forward.
Thank you, Jewel. Jen?
I'd love to chime in. Also, Julie, I love you. We never really catch each other, and we can edit that, but I love you so much. Thank you. Thank you.
I love you.
So I look at family systems. Sometimes parents will come to me with their own mental health imbalances, and then they also have their children that are experiencing things, or it's vice versa. They'll bring their children to me depending on age and range. Usually they're in end of high school, beginning of college. I myself, as Julia also stated, had my own mental health issues from 14 to about 23 before I started to figure out that these were gifts that were coming through for me. And I got to learn how to manage them and express myself in a way that I didn't have shame around my intuition and other things that were coming through, because my parents didn't know how to speak to me about it. So I don't know if any of you have seen the recent documentary, The Program. I went to a program that was owned by that company. So I understand being mishandled in the system and being medicated because of it. And so when I meet a teenager or a 20-something, I'm also encouraging them to start to tap into where these gifts are coming from, whether it's coming in their perception or their sensitivities or dreams, or if it's in their body, why they're holding energy there and how to help move it, because that is where it starts as a child. We have different messaging centers. And if our parents are telling us, oh, that's just a stomach ache when you're nervous to go into a room or go be with somebody that you don't feel comfortable with, and they give you something for it, then you're telling your body to not listen to your intuition. And so it starts very early. So we just start to undo that, and it starts as young as you're ready for. But that's my favorite part about this new evolution of what we are doing and how we can support families and children. So thank you.
Thank you, Jen. Emily, given your personal experience, do you have any thoughts or reflections for teens and young adults coming to medicines?
Yeah, I think I just really feel for them. And I think, it's just incredible the work that Julia and Jen are doing, with adolescents, because I think, for our generation, or at least for me, I couldn't talk to my family, about that. It's like, no, nothing can be wrong with you. We're just going to kind of, shove that all down. So I think, at least, in today's day and age, they have, some social media at least, and they have the internet to, at least to be able to kind of self-explore and do their own research about these substances and topics. And I think they are being, maybe opened up to these other modalities and ways of thinking about mental health conditions. Maybe not, I'm not a super like a fan of diagnosis. I think depression and anxiety are actually symptoms of something possibly deeper, right? And we want to get to that root. And I think there is a lot of trauma, developmental trauma, a lot of collective trauma, generational trauma. And so I think, as we start to just learn about these concepts and theories, hopefully, I think just keeping an open mind and bringing it to, their parents and trying to have that conversation and dialogue. That's what I could add.
Thank you so much.
And one more thing that I'll mention is what Jen was talking about. The parents are such a key component in this. And so let's take ketamine, for example, because it's legal and everyone has access, and we see what happened with the industry. We can't really turn away adults who don't have a good support system. And the reality is that adults have more autonomy. Now, you have these same adults that are saying, hey, can we use ketamine for my child? And there's a group of about 70 of us called IACAP. It's Adolescent Young Adults Ketamine-Assisted Psychotherapy. And it's about 70 plus providers in the country working with these populations. And so we're actually getting together and putting together a principles for parents so that, these parents that are willing to do anything to help their kids, except for their own inner work, understand that there are certain expectations. Like if you're not speaking the same language as your child going in, it's only going to create further distance coming out. And to me, I think it's going to be unethical to treat children if their parents aren't on board with these principles, because at this point, we can still turn these kids away. But treating them without giving them the support, knowing that we're putting them back into toxic waters, can potentially create a consequence that is worse than their previous condition. Because before, they thought their parents sucked, but now they know on a deep knowing level that their parents don't have the capacity to be their caregiver, but they're stuck there for another few years. So the therapeutic container becomes super important for these kids, and anything you can do to support the parents in being on board is going to help these kids.
So important. Thank you. Jed, next question over to you. So I see like all of you, so many people who come to microdosing practice who have been on sleeping medications for 20 plus years. They've been on antidepressants for 20 plus years. And they're just so hopeless sometimes. Like it's been so many years that they feel like they lost. And they wonder if it's worth it after all this time, if they've been on so long that it's too late for them. So I wanted to talk about some of the real world examples you have seen, because I think it's so empowering for people and inspiring for people what is possible for them when you think it's not possible for you. So I'd love for you to share any real world examples or the witnessing you have seen after tapering with hundreds and hundreds of people.
Yeah, thanks for that question. And also to piggyback on what Emily said, that it isn't always a quick process, meaning like, sure, can you taper one antidepressant that you've been on for 3 months and 6 weeks, potentially if it's a low dose. But do we want to do that with somebody that's been on an SSRI like Prozac at a higher dose for X amount of years? I'm going to say past 2, as I'm just going to use my data that comes in. But, the longer you're on it and at what dose and how long you've been on it and what else you're taking plays a role. So really also preparing this person that we have a goal and we get to add space and time with that based on how you're doing through the taper process. Because there are what I say are sticky points in each drop, depending on which medication. And for that person, like Julia said, it might say to taper from 150 to 100, and they might be better at 125 milligram and doing smaller incremental tapers, and having that support and dialogue with a professional that can meet you and support you to also coach you through what you're experiencing. And there's so many other supplements and tools and modalities that we can bring on board as this person is tapering and their vessel is detoxing from years of these meds. So I've worked with specific stories. I'm pulling a few. I'll look at a med list and there could be 8 or 9 medications on there. And there'll be 3 that they maybe have been on at least the last 7 or 8 years. Again, there are some people that have been on Prozac or other SSRIs for 20 years. And that takes time. So I always like to go piece by piece. And sometimes there's merging of tapering. I'm not going to start a taper of a second medication until I know we're adjusting with the first one. So the longer the list or the longer time, the more space we get to create for your body to adjust. And I find that individuals might get in their own way, like because they're having these symptoms or they're not experiencing what they want, or maybe they're having night sweats, maybe they have brain fog. Okay, it's not forever. It just is this smaller window in time. And yes, you have a job and a family and other responsibilities. That said, that's also a great dialogue with the other outlets of your life that I'm doing this for myself. And if things get moved or missed or coming back to at a later timeline, it's okay, because collectively and as the community, we get to support each other wherever we are in our mental health and emotional health. And that's also where I think we're evolving towards collectively, which is beautiful. That said, yeah, it could be, I always look at gut health because your microbiome is affected with many meds that people are on for long periods of time. I mean, not just SSRIs. There's a lot of people are on Neurontin or gabapentin, sometimes for anxiety, sometimes during substance use disorder. Sometimes they do have neurological deficit, or and then they're bringing it in, or diabetics. There's a multitude of reasons. So that's a med that we go slow with. And if you're up at 1,500 milligrams or 900 milligrams, it's not a quick fix. I'm taking 100 or 200 milligrams away per like morning, noon, or night, and that can take 12 weeks. Just for that one med. So it's really a setting up, not having any expectation, really just like preparing them and saying, this can look different for everybody. Because I've had other people that it's a breeze. And that's also where they are mentally and able to self-talk through this. Because also when you start shedding these meds, the emotions that have been blunted or a Band-Aid put over start coming up. So how are we going to support that? And again, like whether it's generational trauma, which what is genetic? Genetic is generational trauma that's coming through that your family members and ancestors have adapted to stress, scarcity, pain, depression, and they didn't have the tools or outlets. So now it's coming down the chain of DNA and into your vessel. And it's not a diagnosis. This is just trauma that gets to leave your body, and you get to create a new pattern and algorithm for you. And thus, everybody that comes after you. So when the parents are doing the work, the children are doing the work. And when the children are doing the work, their children get to come out a little bit cleaner. So does that answer your question? Okay.
Absolutely. Absolutely. Yeah. And I see this just came up in our community with people who get to this place, but they're like, gosh, I'm 75 now. And I so wish I had done this earlier in life. I would have been such a better parent. And it's like, nature doesn't see through that lens. It's such a human way of looking at things, and all the healing work we ever do, whether it's the beginning of one lifetime or the end of a lifetime, it's all one continuum. So thank you.
It's all in divine timing and readiness, and it doesn't matter what is time. Time is an illusion. There's there's so much going on around us that we're not even aware of. And if you get to do, as you know, I'm also an end of life doula. So doing the work at the end of your life is also valuable. So not beating yourself up, having kindness and patience, and knowing even at 70 or 80, as you're doing your own work, you're also doing work for your family members with their awareness or without, because we're all connected to each other energetically. So it's beautiful wherever it lands. And I always applaud my elders that are doing this and utilizing us as their support systems, because I have half the life experience that they do. That said, I've learned a whole nother language in this process that I can support you to make it a little easier on you.
Absolutely. Emily, similar question. One of the things our community has found so valuable is the ability to be reflected while they're moving through the experience and know they're not alone. So they learn what to expect is so helpful in advance of them. Like some people are ahead of them in the tapering. Let's say they went through this a year ago. And then when they're sharing, I am tapering, I am in month 3, 4, and all of a sudden I don't think it's working anymore. Like I feel myself backsliding. I'm worried. I don't know if I can continue. There's other people in the community who tapered a year ago, and they can say, I went through the exact same thing at month 4. This is totally common. So can you talk about some of those instances when people are tapering that are very, very helpful to know in advance, and so not to be so hard on themselves when they're moving through the tapering itself?
Yeah. Let me think about that question. I think, some of the people that I see have really struggled, I think, with a tapering. So I get a lot of clients who have tried and failed in the past. And I think we kind of touched about how they can kind of bring some of that, fear in, like I've tried this before, it didn't work, or, I got down to a certain dosage and then I had to step back up. And so, I think for clients, it's reminding them that it's an individual process, right? I think a lot of people come to me wanting to know, like, how long is this going to take? What is it exactly going to look like? And I can't say. I can share some of the experiences that some of my other clients have went through, what I went through, what my colleagues have been through, but it's really individual, right? And it depends a lot on what medication they are on, the dose that they're on, what strategy did they use before? Where are they now? What tools, do they have? I think it is inspirational to be able to be part of a community, to see, witness other people going through the process who are also going through similar challenges and struggles, and having that extra like container and level of support can be helpful. And I really think, I just wouldn't rush the process. And I think it's worth being patient. And because what I have seen is, I think people maybe not being so intentional, rushing through the process. And then that does kind of like, they backtrack then, right? And I think that can kind of sometimes, be discouraging. So I do think having patience is important. And like Jen said, a lot of these medications, there's drug-induced nutrient depletion, right? And a lot of these nutrients are cofactors for neurotransmitters, like B vitamins, for example. And so also too, in, how I work with people is, educating them on like, supplements, nutrients, and other modalities that can help support their nervous system, since the nervous system is going to be extra sensitive to support brain health, for example. And then, a lot of these medications have been blunting emotions. I've had people say that they haven't cried in years. They haven't been able to cry in years, and get that release. And I believe that emotions are messages. I think emotions are integral as beings to help us figure out, what do we need? What do we need to do? And so I also think, having them being able to talk to others about what that feels like, you now have this, maybe like the emotional intensity is increasing, and how to deal with that, and differentiating, okay, is this a withdrawal symptom, or is this like a relapse, or is this just you being, more in touch with your emotions and feeling that intensity? And so I think just having, support and other people that can speak to that experience in different ways that maybe different people might understand can be helpful during the process. Yeah.
Thank you, both of you. Yeah, I think that it's invaluable having the support and reflection of a guide, your pharmacist, your accompaniment, your community, because you often can't see the 360 of you that other people can. And so you can see oftentimes people are like, I'm in, before weeks, and it's like, I'm just crying all the time. I don't think the mushrooms are working. It's like, well, what else is going on? Oh, I stopped drinking alcohol every day. Oh, I'm tapering at the same time. And so we get to see people in the totality of their spirits versus just this one factor. So thank you for speaking to that so beautifully.
Yeah, it's beautifully said. I appreciate the power of community is so valuable, that you're not alone and you're not in a siphon and you have support. That said, let's also be mindful that we're not taking on somebody else's experience emotionally and making it our own and creating a new narrative for ourselves that doesn't exist, because people tend to, when they're open and vulnerable, can imprint on others depending on what they're, if they're sensitive already and they've been shutting off their empathy because that helps them get through life, then now these gates are open and they're feeling so much more. And we get to learn in the process, is this mine? Is this yours? Is this the collective's? How is that, operating, and what is coming up for me? Because as you have this release of emotion and energy, there is some of that that's yours and some of it's just been blocked, but you could also be absorbing what's around you because you're a very vulnerable, open vessel at this moment. So really getting in there, and it's a beautiful time to start reprogramming and repatterning your stories and beliefs of self and self-worth and loving yourself even more. I always put my patients in front of the mirror and I'm like, even if it's for 5 minutes, just tell yourself how much you love yourself, or for appreciation or gratitude. I'm like, literally spend a minute and say, I'm grateful for my phone. I'm grateful for my computer. I'm grateful for the breaths that I'm taking. I'm grateful, anything to switch you out of your mindset. There's so many fun things that we can start integrating. You might feel silly doing it in the beginning, but trust me, it shifts your frequency and your vibration and you will feel better. So just trust your team, hopefully, and we're here for you.
Beautifully said. Thank you. Speaking of collective, Julia, back to you. You have been a thought leader in the field, particularly around ketamine practice. There's quite a bit of a gold rush mentality around ketamine, given its legal status. And I'd love for you to speak a little bit around the ketamine subscription companies popping up all over. If you're like me, every other ad in my social media feed is for a ketamine subscription. And I know my reaction is like, what about the oversight? What about the human piece of this? What about the integration piece of this? And so I'd love to get your reflections on this, and also your opinion on, in your experience, if someone is drawn to ketamine, what do you think is the best way to approach that substance?
Loaded question.
I figured maybe.
Put this by saying that there's a good book that I read called The 5 Levels of Attachment, and it helped me understand why people are so, why they hold on so strongly to their beliefs. It's their reality. So I like to quote my brother, who said that it's really easy to get drunk on the sweet nectar of confirmation bias. And so if you're a provider and you give your patients, let's say, oral ketamine for home, they all check in with you. You make sure that there's no misuse, and you check in with them. Your reality is that this is safe and it's effective. And so if you are somebody who, let's say we're an IV clinic and we see people coming in after they got addicted to nasal spray, from a reckless provider. That is our reality. If you see ketamine recreationally used, which all of us have seen, plenty, then that's our reality. The problem is these people don't oftentimes get to talk to one another. And so I don't think that the ketamine push was this malicious thing. I think it was providers are like, wait, this works and it's COVID, so we need to send it to the home because this is so much more accessible. This is so effective. Like our patients deserve this. Did businessmen run with this? I think so. And that's where we sit today. We have well-intentioned physicians fighting for this medicine to be accessible and available for people. And we have businessmen who are giving it a bad rap, and it's a race to the bottom. It's how cheap can you get your ketamine? It's not how effective is the wraparound service. And it's sad because we see it in Canada where certain providers aren't allowed to access it because, they're not an anesthesiologist. So now they don't get like all of these loops that they need to jump through when psychiatrists are actually better at doing this, or psychiatrists well-trained who are equipped to do this and have done their own work. So there was Juan Pablo, who was one of the founders of New Life, recently put out an article saying he cannot support at-home ketamine the way that it's being delivered right now. That's a bold statement from somebody who was at the forefront. And I know this company, they really tried to create that wraparound service, but the problem is people don't want to do the work. And if you're going to have another pop-up ad that says do it cheaper for less work, oh, absolutely. The problem is that we're dealing with people who are treatment-resistant depression, people who are desperate. So when they get something that works, try to take that away from them afterwards and say, no, but it will work better with therapy. So I think the cat's out of the bag, and it was before we were able to educate about what really is happening. So I think this year and the next year, we'll start seeing this wave of media coverage of ketamine doesn't work, ketamine is dangerous. And so it's not the ketamine's fault, it's the delivery mechanism. And I like to present this, when it comes to mental health drugs, we think about oral, IV as the delivery mechanism. A mental health drug's delivery mechanism is the provider. And so the reality is if the provider is a home ketamine clinic that doesn't care about your outcomes, it just wants recurring revenue, it's not going to be that effective. And if you plug something that works into a system that is broken, it will stop working as effectively. And we're going to see this kind of in the media. And in terms of the second part with the approach for somebody who wants ketamine. So I think it's still the same process. It's preparation, education. It's a very expensive treatment right now for the people who do want to go the IV route or the wraparound therapy route. So it's what can you do to maximize those benefits? We don't have those tools. We don't have that information on the FAQs and all of these, websites. I've done these questionnaires. It takes about 5 minutes to be qualified. So the onus is going to be on the person seeking the medicine to really get themselves prepared until everybody else can catch up, the providers can catch up. I also think providers are burdened. There's so much need. There's already weeks to months of waiting time for behavioral health specialists. And there's going to be, I think, projected 31,000 therapist shortage by next year. So it's hard to depend on the providers to really give you that education at this point. They're just trying to keep up. So again, educate yourself. Understand why you're coming to this. The other part that I want to touch on is kind of what Emily and Jen were saying about the tapering and the person. It's if a person doesn't know what better looks like, they're going to miss that part. And this goes the same way. So if they're tapering their medication and they don't have what better looks like, they might think they're feeling worse because they're negative bias. You're just focusing on the one thing that's not good and asking those deeper questions of well, you stop drinking, you're sleeping better. This kind of allows them to understand if something is working. So that knowing what better looks like for you before you go to ketamine is going to be valuable. It might even help you realize that this is not the medicine for you. But again, it's unfortunately going to be on the person seeking to really inform themselves enough for this to be effective. And then making sure that they have a support system afterwards. If they know that they're getting ketamine at home and there's not going to be a good wraparound service, schedule your appointments with your doctor, with your therapist, with your coach within 2 days of your session. Like, you take it upon yourself to make sure you're getting the most for the very oftentimes expensive treatments you're doing, or if you're going the cheaper route, for the very powerful treatment that you're doing.
Thank you so much.
I just want to chime in for a bit about the ketamine, just because I used to be a bit skeptical about it. Even as a pharmacist, like learning about it and kind of like, and then I would see a lot of clients come to me again, just doing it, in the IV clinics, because that's what was popping up, and they weren't really getting much benefit from it, and it was really expensive. And but now I've grown to actually believe ketamine is such a powerful medicine and can be so beneficial. But it does have to be set up in the right container with the right education, the support system, people who are trained to administer it, in the correct way. I think it can be really, really powerful. And I like ketamine as an option for many people.
I am obviously very passionate about this as well, being a prescriber of ketamine in the states that I'm licensed to do so. I'm very conservative with what and whom I'm prescribing to. And yes, I'm having follow-up with them regularly. And yes, they're working with some mental health professional or about to, or however that looks. I'm equipped to manage them in this container. And the way I like to use it is, we don't always need to send somebody out into the ethers to have this experience with this molecule. On very small doses, it can be very potent and powerful, especially so I'm going to use an example. I do like to bring it in occasionally if someone has history of anxiety disorder and they've been on multiple medications and we're tapering and it's starting to show up, and we don't want to go to the benzos because the benzos are a bit more risky for them. I don't call it in with a refill. They have to see me. They have to document how they're using it, when they're using it, what emotion is coming up when they're using it, and giving me that feedback so that I can support them. Another place, it's great for chronic pain. I don't want it to fully take the place of an opioid, but is it better and it's a bit safer and regulated, and we're going to still work at a smaller degree, and it's for breakthrough pain, and we're speaking around it, and you have support of the emotional and mental health capacity as a team. And also, it's very powerful for PMDD. Again, small doses. You need to be with the appropriate provider and the ones that aren't in a place where it is the money grab, because as we've seen, they've been popping up like hot. I don't even know how to, there's just so many ketamine clinics, and I only believe about 10% of them are really doing a great job. I've been in many and I've seen it, and just because I'm always interested, and I go in to check it out because I'll have patients, if I'm seeing in person, I'm like, I'll go with you at this, we'll sit with you, because they don't provide anybody that's sitting with the patient. They have an IV, they're monitoring them maybe from a camera, maybe not. It's a sterile white environment. They don't even give them music. There's so many ways that we can be doing this support. And then there's people that are like, oh, this is the way that we need to create these clinics. Let's do it. And we can charge $700-800 per ketamine infusion, when there's others that are working with affordability to $300-400, and then helping this patient gain some sort of access or support through their insurance. Again, this is a team approach, but I agree. There's so many. It's a great molecule, and I also piggyback on what Julia said, that we might see some negatives coming out about it, which is okay, because that's the pendulum swing, and we get to see both sides of this as we're all emerging into this newer space of treatment and modalities for individuals. It comes up all the time. Even, to be honest, people in the space will ask me to prescribe them high doses of ketamine, to be honest. And I've put the kibosh on that, and I've gotten pushback, and I've had my license threatened by people in the space because they think that that's going to be a good thing to do. And not many, but that's what's existing out there. We have some amazing souls that are here to really pioneer this work. And we have others that are good souls, and they're figuring it out and part of their process, and they're playing a role in a character. That said, we don't want the vulnerable in front of them while they're going through some of these mental health challenges. And that's up to us to really shake it out while we're doing this.
One thing I'll add to that. So when you use ketamine regularly, and this is again, those people who have it sent to their home and they break up their tablets because they don't want to, they want to space it out. They start using ketamine at lower doses regularly, and they're actually going to eventually have lowered resilience and increase the symptoms that they had in the beginning. So what do people do? They take more ketamine and it works for a little while, but eventually this is still that same kind of diminishing returns. The tricky thing with ketamine is that if you have a personality disorder, you're a narcissist, this can actually make you more of a narcissist. It's not like this like magic bullet that takes away those like gnarly things about you. It actually enhances it. And so this is where we have a very different, like huge range of how ketamine is used. From the CEOs who want to optimize, potentially in this category of kind of personality disorders, to the people working with it underground without any real regulation because it's safe. And then you have the complete other side of the spectrum with Spravato, which is the nasal spray. Now, I have my feelings about it, but in terms of accessibility, this is definitely more accessible. You have insurance coverage. They have something called REMS, which is a risk evaluation mitigation strategy, meaning every single vial is documented. It is assigned to a particular patient, and they have to do all of these forms, like the questionnaires that a lot of times clinics just can't per cats, but this mandatory is part of it. And like really trying to regulate it to the best of their abilities. This is a huge range for a drug. There's no range like this with psilocybin at this point. So the publicity is going to come from every which angle. And so it becomes really important to create a approach for ketamine that kind of puts the guardrails up so that it's safe no matter what reality you exist in.
Thank you. Beautifully said, all of you. Appreciate you so much. So to wrap up, I love to ask all of my guests to suspend reality. And in your highest vision, how can you envision psychedelic medicines being incorporated into society where we are now in the safest, most equitable, and most effective way? Let's start with Jen.
As I said, I'm free-flowing this, so I didn't prep on purpose. I love the question, and that's a big, loaded place to come from because we all have these perspectives from many years on the traditional Western medical side of things. And there are some positives to the way that some treatments work for patients. And that's beautiful. And we've created a whole layered onion of more issues that we get to process and manage within ourselves and our coworkers, our families, our friends. I think that psychedelics, again, they're not the quick fix. It's not like it's a one and a done. It's a relationship with the molecule that's with yourself and how you perceive information. So I believe these to be openings, and they can be a quicker process that they do that because they do give you these insights that you're like, oh my God, I didn't even realize that was how I was operating. And it's this aha moment that happens. Sometimes they're big aha moments for hours in a journey. Depends on what you're doing. They're gifts, and to truly utilize them in how we're creating, I believe we're creating a new psychedelic medical model. So these are the tools and modalities that we get to utilize to help our own healing paths and journeys, whether it's physical symptoms, mental symptoms, emotional, and as a team, as our community, we get to support one another, where traditionally medicine was really managed like in a siphon, and there wasn't communication between other doctors or doctor and therapist or the social worker. Like nobody was talking to one another. So each individual had a slew of opinions going on when they're already a bit confused. And now we get to all communicate very openly and know that because we do our own work with these molecules, we're better showing up for you while you're working with these molecules. Because if I know myself, I know where I can meet you. And if I can't meet you there, then I'm going to find somebody that is appropriate for what you're experiencing in this moment at this time. And we get to utilize each other in a much more transparent way. And again, taking our own accountability and ownership that we're playing a role in this. And this is the reality that we've created. So how are we going to create a better reality with these powerful tools and molecules that really help our nervous systems, our brains, our emotional bodies to be the best versions of ourselves with the work, with the prep, with the integration, with the communities. And I always say that some of these molecules are my CEO, and I check in with them in the way that I feel called to. And without them, I wouldn't be where I am at all. They are the ones that have led me on this path to show up for others. And I know that they have the capability to do that for so many. So there's where I'm at with them.
Beautiful. Thank you. Emily, how about you?
Yeah, as I reflect on this question, so many things are coming up for me, but I think overall, I wish, like as a society, that we lived more in reciprocity and harmony with nature, and that we embodied, certain traits such as like empathy, sensitivity, kindness, being in community, and I think a shift needs to happen too. Earlier in the podcast, just touching about how, when we do these, we work with these medicines and, we're healing and changing our own narratives, the environment is still there, right? And so I think what we've seen is that even if we're changing ourselves, if the system, the environment is set up in a way that's not supporting us, that's a problem. And I think that's going to be a problem as we introduce these medicines into the current system. And I think I read somewhere about like 60% of all medications available come from natural products. So they come from nature. And it's just so crazy to think that, these pharmaceutical companies are just extracting and patenting and making so much money, trillions of dollars worldwide, when over half of Americans can barely afford healthcare and, medication costs or access to affording things that are going to set them up for, well-being and a high quality of life. So I think for me, ideally, all of these medicines, that come from nature that are here to help, serve humanity, to alleviate suffering, to, heal us, should be available and legal and accessible, and coupled with the proper, harm reduction education, how to use it, which one's right for them. Is this the right one for them? So I wish all of that could kind of be like integrated into, our society going forward.
Beautiful. Thank you. Julia, how about you?
Easier for me because I had two of you go first. So I like to say this like the soundbite came to mind at one point where I look at, psychedelics, they bring light to the shadows within us, but they also bring light to the shadows of the systems that they touch. We see it with policy, we see it with funding, we see it with clinical applications of these things, we see it with research. And, one of the things like Jen mentioned was multidisciplinary approach. We talk about it, but we don't do it nearly as much. We do it more in the psychedelic space because it calls for it. And, another thought is informed consent. There's big stuff around informed consent with ketamine. And it's like, well, how do you inform consent when talking about the ether? It's like, okay, well, let's focus on informed consent. And let's look at the fact that nobody that's getting prescribed an SSRI is getting informed consent, especially not the kids. And the other thing is group therapy. We're trying to figure out how to make psychedelics scalable. So we're starting to pay attention to group therapy. But look at the Roots to Thrive model. They compared group therapy, like the community of practice of 12 weeks, to that same program with 3 group ketamine sessions. The results were almost the same. So like the improvements in the results in patient outcomes. So to me, And then the focus on kids and families. Like that, I think, is going to be the next phase of psychedelics. One of the realities is even though no SSRI has been shown effective, if a company comes up with a new SSRI for adults and then they choose to study it in adolescents, they get a 6-month patent extension on their drug, worth the millions of dollars that they get. So for me, my hope with psychedelics, and of course, when it comes to kids, I want this to be an option for them younger with proper support to get them back to who they are before they go to college and into the world on their own. Really soften that transition for them. But to me, when it comes to mental health care, we're really focused on psychedelics not being an everyday thing. Even the Spravato model where it's like once a week or every 2 weeks for the rest of your life, we're like, but still, psychedelics are not meant to be an everyday thing. They're not meant to be a forever thing. If you're going to do a microdosing regimen, maybe you do it for a couple of months, then you take a break. Imagine if we approached mental health drugs the same way. And I think that there's a lot of negativity towards the Western model. And I completely understand why. I'm kind of with them with the, picketing outside the doors. But the reality is that maybe sometimes you do need an SSRI because you lost a loved one, and leaning into that is actually really painful and you need to stabilize for a little bit. And that is okay. The point is that that your prescription is not a life sentence. It is a crutch, the same way that a psychedelic can be for a period of time. And so to me, it's like if psychedelics can make us change how we practice regular medicine too, I think that would be ideal.
Beautiful. All of you, thank you so much. I'd love for you to share with our audience where to find you and follow your work. Jewel, let's start with you.
So I have an Instagram account where I upload, as I read books, and Children of the Cure, there's a highlight reel from that book of audiobooks. So it's called Mirer Notes, Mirer Notes. And I'm also on LinkedIn. So if you reach out to me on LinkedIn, I'll eventually get to the messages. We'll go through all my messages. So those are my
Well said. Emily, how about you?
Yeah, you can go to my website, dremilykulpa.com, if you want to get in touch with me. I'm also on Instagram. I haven't been posting as much lately on there. And you can also find me on LinkedIn if you want to send me a message.
Beautiful. And how about you, Jen?
So my website, as you know, is going through a second iteration. So bear with me if there's any little spots that are getting worked on. It's www.iresonatehealth.com. My company is Resonate Health, and you can find me on Instagram as jen.zuckerman. I post different things about the body and psychedelics, depending on what's flowing through. I have a LinkedIn. I'm not so great at checking it. I'll see it in some few months, or you can email me at jennifer@iresonatehealth.com. And I look forward to hearing from whoever this resonates with.
Beautiful. Thank you all. And for those of you who are listening that are contemplating tapering and looking for support, both Jennifer and Emily have consult bookings on your website, right? And through Social. Perfect. Great. All right. Thank you all again so much. Thank you for being with us. Again, we'll put all these contacts and references that they mentioned in the show notes. And we really appreciate you being here. So see you back in a couple weeks.
Thank you, Casey.
Thank you.
Thank you for listening to today's episode of the Microdosing for Healing podcast. Are you ready to take the next step? Please visit us at microdosingforhealing.com to access our free Microdosing 101 workshop. In it, you'll learn more about our diverse community, our supportive group programs, and discover if earth medicine practice might be right for you. See you in the next episode.